Hi, Salamun alaikum. Namaste. Hole. Ahlan. Durud. How are you? How are you, my dear friends? Long time. How's everything with you? How you are doing these days? How are you, my American friends, my European midwife friends, Indian, Iranian, Afghan, Nigeria? How is everything with you? I miss you so much. I was busy in these days. I could not come for continue our training, but I promise you to come every 8 days. You were asking me some question. What's exactly physiologic birth? Have you heard about the definition of physiologic birth according ICEA, the International Childbirth Education Association? Yes. Yeah, ICEA recognizes the birth is a unique and synergic process between mother and fetus, while the use of technology in maternity care worldwide increases, maternal infant morbidity, mortality rate have not shown significant improvement. ICEA defines physiologic birth as a birth where the baby is birthed vaginally following a labor which has not modified by medical interventions. So, if you follow this definition and follow your midwifery practice according to this physiologic process of the birth, you will feel more comfortable to managing your patient through physiologic birth. I know some of you midwife and doctors, you studied and you practice your midwifery according medicalized midwifery and obstetrics rules. Actually, we, as a registered certified midwife, we studied according obstetric references, and we know how to manage the birth by medicalized midwifery. But according this ICEA recommendation, we are trying to change our practice for our mothers and our birth with first preference by physiologic birth. I know most of hospital midwife and most of certified midwife, they are more engaged with medicalized and hospitalization birth. But if we work in our private sector as an individual midwife, if we want to run our birth center, our first preference should be with physiologic birth. You know why? Because physiologic birth has less incident. Physiologic birth is more safe. And you can let your mother to try with low invasive medicalized birth, to try to go through natural spontaneous mode of the birth. And later, if needed, then we will try and practice according our medicalized obstetric and midwifery. I have experience with different type of the birth. I was practicing according our national standard medicalized midwifery many years, and I was managing my mothers through Williams obstetric references. We don't know how much it was difficult job for the midwives. Because if you want to start a small intervention, if you want to start a small medicalized birth techniques, so you will go with many complications, and complications comes after that. So you need a big team, you need a very facilitated hospital, and small drops of induction of the labor. If you apply for the mother, the consequences of that will be more complication. You will see more CPD, you will see need of episiotomy, You will see even sometimes a surgeon call, and you will find many even complications for the newborn baby. But as soon as you practice physiologic birth, you will see that how much everything goes smooth, and you will not this much headache and complication during your birth process. You will be happy, mother will be happy, and medical staff, medical midwives, they will not be engaged this much in this troublesome process of hospitalized and medical birth. So, as a physiologic birth midwife, you need a team. You need a very cooperative team. The first thing that for physiologic birth you need to talk and facilitate is your doula and mother's husband. The first line of your teamwork. Yes, it's very important. If you can find a very commitment, up-to-date and very cooperative doula, you will get many advantages during your practice for your mother, and you will get a safe birth for your mother as well. So it's very important which kind of doula you can find for your team. The second important role is for husband as one of your team. Husband should be very oriented about the process of the birth. He should be very alert and good trained about how to support his wife. He should get enough information about psychological and emotional support of the wife. And this group will help you to facilitate and smooth the process of the birth for the mother. The second thing in your team is very important. The second role is for midwife assistant. Midwife assistant is very important because the midwife who is standing with you to help you, and maybe she will help you for neonatal resuscitation, or in other cases if you have some emergency need, she should be very skilled and very ready to help you. So it's very important to choose proper midwife assistant for your team. The other person that you have to consider in your birth team is your nurse. There are some nurses in some hospitals, in some birth centers, that they know how to come in birth teams, and they know how to provide support and help for mother, husband, you, and your medical team. The other person that you need to think to bring as a proper one and like-minded with you for physiologic birth is your obstetrician. In some countries, for example, like Iran, you have to find one obstetrician that for some cases like VBAC, or some cases like epidural birth, to be with you. You need their support. So it's good that at the start you consider one gynecologist, obstetric gynecologist, and one anesthetist doctor in your team, that they be like-minded with you, and always they be on call. As soon as you call them, they come in the emergency cases to do their operation. And the other birth team, important birth team person is pediatrician. If you want to work safe in water birth, in VBAC, in epidural, you should always have one on-call 24 hours pediatrician in your team, in your hospital. Because if you go for any other reason, that the baby upguard don't be stable, that the baby upguard don't be as favorite 9 to 10, you may need some pediatrician to be available at the time of the birth to help and to survive the baby. I'm talking about privileged midwives who are going to do their birth in the hospital, and they need to have a very organized team member for the birth time. But if you are working in your birth center, maybe you won't need an anesthetics doctor, pediatrician and obstetrician, because you are going through only hands-off birth like water birth and low-risk mothers. But if you want to try for every kind of birth, and if you want to get secure insurance and legalize, you have to go through multidisciplinary team and trusted person that they can come on time in your help and in emergency cases. I think I have 4 minutes time, and I'm trying to help to others midwife who has many doubts how to practice in different countries, to find their way, to open and smooth their success way, to help to mothers and develop their business. When I sit with some of you in different countries, in different practice, I hear that how much you have different challenges in your midwifery practice. I am very familiar with hospital midwife, and I know how much they have engaged and how much they have challenges to be autonomous and be decision maker, because in some countries still obstetrician and gynecologists, they are not believing on some midwives, and the midwives are not that authorized to work independent and be supervisor for the birth for the mothers. And I know some of you as an individual midwife who are running your own birth center, how much difficult business running you have in this situation. In some countries we have birth center, in some countries we are not allowed to work in birth center as a registered certified midwife. But we can find and modify some way that we go according to the rule of the country, and we can help to our mothers and develop our midwifery practice. It depends how you will do. In some countries, we are trying only to work on family health as a midwife, because this is allowed in that country. Maybe we are not allowed to work as a midwife for birth, but we can work on sexual right, health, and fertility. Yeah, there is many pre-consultation centers that you can work on that and give enough information before marriage to couples. Or in some countries, if you find mortality rate in a high rate, you can try to work on training, health, and family education for new, young, and couples. You can try even to make some movie or program regarding public health, family health, and women sexual health and right. It depends how you want to practice your midwifery according to the need of your situation, the need of your population, the people are living there, according to your legalization and according to the rule. So midwifery is very fantastic independent job, and it is with variety of the field for practice and to help to people. I hope I could have a short and brief description about physiologic birth. Please, if you liked this live, do like us, and please go to our YouTube channel. It is Leila Mom Center LMC. Please subscribe and do like and share with your friends. Your subscription in our YouTube and your comment and suggestion will motivate us to continue our short training continuously and consistently. Thank you so much. Love you. Have a great time today. Bye.